everyone, thanks for tuning in to Shannon and Veronica Know Everything. So today we're going to be going over AV heart blocks. So when I'm talking about AV heart blocks, if you can see this picture here, essentially it's saying that the AV node is firing, but then the messages, the electrical conductivity coming from the AV node is blocked. So know that there's other types of heart blocks. We can have bundle branch blocks, so that's when the Purkinje fibers, bundle branches are blocked. But with AV heart blocks, it's just the AV node that is being blocked. So when we don't have the AV node, then we have to kind of slow down the heart rate and we jump to electrical conductivity coming from the atria or from the SA node, which is 40 to 60 beats per minute. So very low. When we talk about AV heart blocks, there are 4 different kinds. There's first degree, second degree type 1, which is Wenckebach, second degree type 2, which is Mobitz type 2, and then third degree, which is known as complete heart block. If you are going to cut out in the middle of this video, that's fine, but stay for this one thing. Know that if anything after a Wenckebach is going to be deadly. So type 1 and Wenckebach, they're pretty much chilling. Mobitz type 2 and third degree, you can die from those. So that is a very important thing. If you have a patient in Mobitz type 2 or complete heart block, put the pads, pacer pads on them, they are going to crash. So to start off with, first degree heart block, the way we can identify that is prolonged PR interval. So the poem, if R is far from P, then you have a first degree. So essentially just prolonged PR interval. Normally the PR interval is 0.12 to 0.20 seconds, so it's when it's consistently longer than seconds. So it's when the PR interval is consistently longer than 0.2 seconds. So as you can see here, it's long, but it's consistently long first degree heart block. What causes first degree heart block? It's if you've had, there's a lot of causes, but the main thing is that you've had a previous MI. So if you get an EKG, you're just going to want to inquire, has this patient had an MI before? Yes, okay, that makes sense. No, okay, we might want to look into why. Treatment, nothing, just means they've had an MI. So for second degree heart block, Wenckebach, you can remember it as longer drop, then you have a Wenckebach. So the PR intervals become progressively long, and then you drop a QRS complex. So the treatment for this is also essentially nothing. If the patient is symptomatic, then you want to control their symptoms. You want to bring their pulse up if it's low, but for the most part, Wenckebach is very benign, so do not worry. You can wink, and don't worry. And then Mobitz type 2. Mobitz type 2 is different in that you have normal PR intervals and then you just randomly drop a QRS complex. So the treatment for this is going to be a permanent pacemaker or transcutaneous pacing. So if a patient's in Mobitz type 2, put on the pacing pads, we're going to try to control their symptoms, but the likelihood is that eventually they're going to end up pacemaker. Moving on to third degree or complete heart block. The poem for this is when P's and Q's don't agree, then you have third degree. So I kind of tried to draw it. Essentially, it's when the P's and Q's just don't match up. Like, there's no dropped QRS complexes, that's all going to be type 2, but essentially it's when you're looking at it and you're like, this rhythm doesn't make sense, there's just random P's. Sometimes the PR interval is long, sometimes it's short. It just doesn't really make any sense, then it's probably third degree, and it's going to be a little bit slower too. So another way to remember this, we have the heart block poem, which I kind of went through. Another one is with a husband or a spouse showing up to dinner. So first degree is that so let's say my husband's name is Mike. So first degree is that Mike comes late to dinner every single night forever, which is annoying, but benign. Wenckebach is that he progressively shows up to dinner later every night. So like, he's chilling, he comes a little later, 10 minutes, half hour late, and then one night he just doesn't show up for dinner. Still benign because he sends me like texts, okay, I'm showing up a little late, and then he misses. So it's a little more benign, or also benign. Mobitz type 2 is that he just randomly shows up, no warning, nothing. That is not benign. And then complete heart block is it's just chaos. Sometimes he comes, well, he always comes because there's no drop complexes, but it's just complete chaos and we don't agree at all. So permanent pacemaker. So that is the AV heart blocks. To recap, we talked about the 4 different types. Remember, Wenckebach and first degree benign, Mobitz type 2 and complete heart block not benign. And remember, the pathophys always that we're talking about blocked conduction from the AV node. Thank you.